So we'll begin with Dr. Pallavi Chobe's lecture. Dr. Pallavi, I do have your introduction, so I'm going to read it. But for me, she's like ever energetic, always wanting to do something more, always want to be focused on patients' well-being. She will call you if she's, having any query that, okay, what can we be done in this with ozone. She's ever energetic, also a good orator. She speaks, she talks about arthritis, knee joint pain, pain management through Ayurveda. Also, a lot of cancer patients she's been dealing with since many years. From Chikmagalur, right? Or now where? Bangalore. So, Dr. Pallavi, over to you. She's going to talk about cancer patients with Ayurvedas and case studies.
Okay, integrative Ayurveda and my experience with cancer. Okay, thank you, Miliji. Good morning to all. I hope everybody is very happy. Good morning, good morning. So yesterday something is working, what Miliji said. Reciprocate, okay. हाँ तब तक दूसरा बात कर लेते कोई प्रॉब्लम नहीं okay so today अगर आपको पता today if you know our prime minister is at my place. He is in Belur. So I got married to a small place which is in Karnataka. It is a taluk place. So prime minister today is there. You were talking about him. So one simple yoga pranayama if can make a big difference in a person's life and energy. Imagine the rules and the constitution given by nature to us, what we call is Ayurveda, how it will take us, where it will take us in our life. Not only in health. Health doesn't mean life. You know, there are many dimensions to our life. So I belongs to a category where I like to help people in the direction that is what I told you is Ayurveda. And I am working in integrative Ayurveda section. I integrate these principles of Ayurveda to other biological therapies to give relief to the people who are suffering for a long period of time. I'm an Ayurveda evangelist, I'm an educationist, I educate people. I have a signature education program, which is the disease education, not health education, which won India Health Wellness Award in 2020, known as a No Disease, No Disease, KNOW. KNOW, No Disease, No Disease. I am very happy yesterday because what I was thinking, it was right, because I was threatened by people that you should not talk about that whatever your problem you came up with, maybe because of vaccine. So yesterday it was embossed. What I was thinking, the thought process was embossed. Yes, there is a vaccine injury, and what I'm observing, it is not of like it was not worthless. Like what I was talking has some base. It may be because of vaccine, the people coming to me, because I came across 3 people. In school, we had a vaccination, January. These children were vaccinated January and the starting of the February, Karnataka. Maybe you people know that. 2 vaccine in 30 days of time, and we came to know. I got, which I believe, it takes around 5 months or 8 months of time to develop the pathology, and I found it out. 3 small children between age 15 to 18 got cancer. So the problem is we have our brain washed that Ayurveda working very slow. So I couldn't, they came to me, they talked to me, and later on they took a decision maybe to ampute or maybe to cut and maybe to do radio chemo. It is a very, when it comes, one thought process come in my mind. अच्छा change करने के लिए पीछे करने के लिए ठीक Okay, thank you. So that is the starting of my talk is, we just came across the another side of a pandemic, we made it. But I'm thinking, actually, was it really necessary? See, uh, what we are afraid of. Okay, if I afraid of somebody who has a knife and come and attacking me, but what we are we are afraid of a small single organism, don't have cell wall maybe, don't have cell wall also to protect. We can't see him by our bare eyes. On a one needle, you can see 10,000, 15,000 virus can sit. And we are one of the intelligent species in the nature carrying the weight 50, 60, 80 kg. And we locked ourselves inside house for 1 year straight. What exactly threatening us? What exactly made this change? A small virus which we cannot see by bare eyes. You know, they used to say that मैं घर के अंदर तो corona घर के बाहर. You know that ad used to come, right? If I sit inside, the corona will be outside. Isn't it? And when the vaccination happened, we went and took that virus. We were locked ourselves for 1 year straight so that corona should not go inside me. And when vaccination happened, I went and took and came home. So the thing is, what exactly? See, I'm not against of anything which is happening, which made me think, this patch made me think, what is actually threatening me? It's not the virus. It's the wisdom of that virus. It's the wisdom. See, that small coronavirus using all his energy, using all his power and knowledge, what nature gave him to survive in any worst condition. Isn't it? Isn't it? That's what we called it as a mutation. Whatever the antibiotics antiviral drugs we came up with, it is not working on that virus because that virus made himself so that it can survive in any worst condition. Come whatever it may, I will do to survive my species. Whatever, come whatever it may be. I'll do something so that my species will survive. But we... Yes, no problem. I will finish, don't worry. Before time. Before time. No, don't worry. No, I can understand. So what is that species is doing? Using his wisdom. Come to us. We are the most intelligent species on the earth. We can make changes, we can think, and we can change whatever happened in the past, in the future. Isn't it? We have power to change in future the mistakes we did in the past. And that's where my actually project lies, Ritvi Wellness, which make changes in people who are suffering in the diseases. Our main core area is chronic degenerative diseases. So the things we couldn't do in the past, at least we will do today, and tomorrow we can change whatever we are suffering with this body. So we deal with many diseases, but today I will talk about something known as a cancer. I don't want to talk because I'm still learning phase. Cancer is teaching me different lessons. One of the lessons I learned from cancer, that is, yes, there is something known as a destiny. We have to believe every patient comes with a destiny. So I'll talk about this lady which was 65-year-old. She has a history of a diabetes, uncontrolled diabetes, CA larynx. She already took 50 chemo sessions when the top oncologist in certain hospital said, I want to see that lady who took 50 chemo sessions and still alive. So I don't know, because she is at age 65, she was alive. That lesion was stable approximately for 3 years. Then corona happened. During this corona, she also suffered with corona. She was admitted. Lot many steroid injections was given. Because of that, sugar become uncontrolled, and whatever the mass was, it started becoming active because she was on a continuous PET scan for every 6 months. So she was advised doctor said that if she can take 50 chemo, she can easily take 15 radio sessions. So radiotherapy was advised, but she was not willing to undergo that. She know that I took it, but I know what is happening inside me. I don't want to take it. Let me die peacefully. So she opted out of radio. Her son found that we are doing something which may be helpful for her. She was very weak, collapsed, went depressed, with uncontrolled sugar, edema all over body, not able to walk, breathless, not wanted to go further in her life also. So integration we use in this case is Abhyanga and Svedana. Let me tell you what is Abhyanga. It is a scientific process where we use some oils, depend on person, what exactly we want the outcome is, and we press some points of our body. Yes, it is a massage, but Abhyanga and massage has a very big difference. Why we do that? Because you do something known as an antibiotic or chemo sessions, then there is a lot more cellular waste created in our body. There is no way out, our body can throw it. So this is a procedure which help us to mobilize that cellular waste, and rest of the thing we do, that is a ozone steam, major auto that we did in her case, rectal for maintenance, nutraceuticals, different cocktails, chelation therapy, IV vitamin C therapy, and of course there are some medicines. Fermentation process make anything so light that our cell can easily absorb, and based on that we have a preparation known as a asavas where we ferment different herbs. So the outcome was, after 2 months she was very grateful, sugar was very controlled, and the mass was stable because we did PET scan. She was energetic, breathlessness was gone, she was able to walk 5 kilometers, she was able to resume her healthy lifestyle. Months together she could maintain all that. She planned her India trip with her sister. She did that. This all good condition remained for 1 year and 8 months. After one trip which she did for 3 months, she came up with a small lump on the neck, and definitely I asked, go and visit your doctor. That doctor sent the thing to the biopsy, and during the result come, doctor said, let us plan for 6 chemo sessions, preventive, for prevention. And biopsy report come after 3 chemo sessions. Biopsy was negative. I don't know whether it is visible or not. So biopsy came negative. We all were happy, but her daughter was a decision maker. She was a PhD holder. So she said, no, we will complete the rest of the chemo session. She undergo rest of the chemo session, landed into respiratory failure, and she is no more. So, destiny. So, another lesson I learned, just go with the flow. Yes, integration works. One lady come, she is a 52-year-old female, colorectal cancer, per bleeding for 2 months, got operated. She was advised take 4 chemo session, rest of the thing we will decide later. But after first chemo, she got drained all. For the 18 days, she was numb, like she used to feel numb and lethargic, fatigue, no energy at all. She not used to come out of the bed. She completed 3 sessions. She came to know, and this time she said, can we do in my case something? So I said, when is the next session? Next session was due 1 week after. So we finished with integration. So we couldn't do Abhyanga in her case, but Ayurveda medicine, we gave her strict diet because she landed with AKD, chemo-induced AKD, and before 4th dose, we gave her vitamin C. For 3 days prior, we gave her high dose vitamin C, and after chemo, giving a gap of 3 days, again we started few things. So after taking chemo, 18 days she was suffering a lot, not able to come out of the bed. So those who are just thinking, giving a try to do, definitely, because this all suffering, we could reduce it to 5 days, 6 days. She was energetic and she was in the kitchen, she was doing all the work, and she connected all her family. Come here. There are few things, few changes happen. So she connected her husband and 2 children and their wife and her 2 pote and all that. Okay, so we found these distressful days period. Sorry for the spelling mistake. Post chemo reduced to 5 days. Mobile, energetic, edema is reduced. So we use some Ayurveda medicines which help, which are kidney protective. Doing all work for long standing. breathlessness is reduced. So the third thing, actually third case told me, you can be bold. Okay, so I have some cases. This case, this lady actually, she taught me, you can be bold, Dr. Pallavi, you can be bold. So how you can be bold? So she came, 50-year-old female, biopsy shows that there was ductal cell carcinoma. She came with a heaviness in the breast, growing a lump, lymphadenopathy under arms, mild fever, lethargy, known case of a diabetes which was uncontrolled. Already previously operated for the abscesses 2 times, and she was advised radical mastectomy. She is a 51-year-old Marwadi. She didn't want to take this breast out. So she just asked me, can we do something? I said, yes, let us try for this. So the thing we use, she is a G6PD incompatible. So what we use is only local ozone cupping at that site. And Abhyanga, we have beautiful another way of insufflation medicine is a basti and Svedana chelation. Definitely when I say Abhyanga means the it is that Prakruti Stha Abhyanga means which oil we use is a very particular in the patients, okay? And Ayurveda medicines, nutritions and diet and cleanse program, for example, colon cleanse and liver cleanse. What was the outcome? She was feeling energetic, weight is maintained, weight loss was there, weight is maintained, breast heaviness is reduced, redness is reduced, palpable growth felt reduced. After 2 months, patient opted out, rest of the chemo, she said, I don't want to go for that. You do something. So 8 months later, actually we did MRI, her PET scan is due. But we showed that MRI, so-called oncologist who is going through this, and he said, no, we will wait. We will wait and we will see whether it is really mastectomy, radical mastectomy is required or not. So these cases made me bold. So in next case, which I told you, I took a very bold decision. I didn't took bold decision. Actually, patient forced me. You can take bold decision. He is a person with thymic neuroendocrine carcinoma. I don't diagnose anybody. People come with prior diagnosis. They only come and check whether I can do something or not. So he is a 52-year male. He came with a complaint of lethargy, feeling drained out, pressing pain at the chest area. I think yesterday somebody talked about these thymic tumors. So lasting cough, constipation for past 3 months, associated via diabetes, fasting sugar 260. So integration we use in my center, Ritvi Wellness, we ask person to come 21 days straight and we do this integration. In 1 day, a patient undergoes 4 to 5 different therapies. So it's Ayurveda plus nutraceutical and plus anything we want to add. Okay, so chelation, hydroxy cocktail, hydrogen peroxide. You can see histopathology which mention endocrine carcinoma. The outcome is sugar drop, patient feeling energetic, previous complaint of chest pain becomes 0, maintain weight, Abhyanga, Basti, rectal ozone. Ozone, major auto weekly twice we use, 10 months later PET scan is done which says that mass is same after 10 months. An oncologist said, wait. The chromogranin level from 160 reduced to 32. The oncologist said, let's wait. So, that is what I believe. Not everyone can be a very great doctor. But if we are really a doctor, we will believe a great solution can come from any source, can come from anybody. We should be humble enough to accept it, implement it, because it is a question of one life and one family. Thank you. So before time I finish, मिली जी, मैंने टाइम से पहले फिनिश किया है, ठीक है ना? इधर 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 इधर. I respect your words. Your words are my command. Huh?
Thank you, Doctor. So I request Dr. Karthikeyan ji to come and felicitate. Sir, you agree to me that she's a good orator, right? Very dynamic person.